My experience working in the camps and with the people of the camps is that seeing their living conditions and how they live is extremely humbling and heartbreaking. It's upsetting to see that the way that they live and how they've left their lives behind and created a new life.
A tremendous experience to be able to treat them, to be able to interact with them. They're very strong, proud people, and you know, it's a privilege to be able to help them, and even just a little bit that we do, it's an honor to me to be able to help them. And you know, I hope that we can continue to try and make their world a better place, and then hopefully the world can rally eventually to try and change their circumstances.
The patients I'm evaluating today are getting ongoing dialysis treatments. I was surprised to learn that the traditional recommendation for dialysis is 3 sessions per week, and if not more. Here, under the circumstances, a lot of the patients are getting twice-a-week dialysis, and at that, even a bit of a stretch. The dialysis treatments are covered by NGO organizations because as refugees, the coverage and the funding becomes very difficult. So these patients are under a lot of challenges to try to continue their medical therapies and, frankly, to stay alive from more than one perspective.
I'm part of the urology group. We have had several rooms of urology going today here at Al-Hariri General Hospital, in addition to a vascular surgeon who is here.
The support staff here at the Hariri Hospital have been also excellent and very, very helpful and very accommodating. For example, I'm being allowed to do 8 cases today, which back home would have been almost impossible. They are trying to be as accommodating as possible to myself and my colleagues, and this has been a really, really gratifying and excellent experience, and we are absolutely anxious to build upon this experience. We are working with surgical residents, which clearly will help them learn and help us expedite the care of the patients. The other attendings that are here from anesthesia to surgery have been very welcoming and appreciative of our efforts. I think that it is imperative that any surgeon, Syrian, Lebanese, American, Indian, or any other nationality should offer their support for these displaced refugees. So I think the idea of becoming active should start where the need is the most, but hopefully we can even extend our services anywhere in the world as this trend continues. We are very fortunate with the SAMS organization as being a leader in this area and really paving the way for this excellent collaboration between the volunteer organizations and the government institutions that are here.